hands should be the most sterile parts of your body, but surgeons puncture gloves during surgery all the time without even knowing it. This means the gross germs and sweat from their hands can leak out of the gloves and cause surgical site infections. Double gloving can help prevent this, but don't just wear two of the same gloves over one another. The glove you wear first is called the puncture indicator underglove. It has to be half a size larger than your regular glove size, and in a darker color like blue or green. The overglove is usually white and has to be in your exact glove size. Surgical gloves are pretty sturdy, so one pass with a surgical scalpel is not going to cut them, but other sharp tools and sharp edges of broken bones can easily slice through, which is why orthopedic surgeons must always double glove. To prevent hand sweat from traveling up your glove sleeves and wetting your sterile gown, get some sterile tape and wrap it around the ends of your glove sleeves to seal all your sweat inside. Taping your gloves to your gown also prevents them from slipping down in the middle of surgery, but make sure not to wrap the tape too tight or you'll restrict blood flow to your hands. If you don't have sterile tape, make sure the cuffs of your gown stay below your wrist because they are not waterproof and can wick sweat, so sterility will be broken if your glove cuffs ride down during surgery to expose your gown cuffs. Wearing blue indicator gloves under your main surgical gloves will allow you to easily tell when you have torn the outer gloves and need to change them. Here's the slickest way of taking off disgusting surgical gloves without getting any of the grossness on yourself. Pinch the palm or side of the glove on your non-dominant hand with the first 3 digits of your dominant hand. At the same time as you're doing that, pinch the dorsal side of the glove on your dominant hand with digits 1, 2, and 3 of your non-dominant hand. Now as you pull your hands apart, the gloves will come off and invert into one another so that all that necrotic, purulent grossness is contained inside and you can grab and dispose of them without fear of getting contaminated. This technique works in both open and closed glove situations and even for taking off non-surgical gloves. For non-surgical gloves that are more loosely fitted, you can remove them by pinching and pulling from the palm of one glove, then with your clean bare hand, sneak a finger under the opposite glove sleeve to pull it off. But the sleeves of surgical gloves are very tight fitting because you have to wear your exact glove size. Comment down below if you also wear a size 6.5. But yeah, this technique risks you being contaminated by the outer surface of the glove sleeve while trying to slip your finger in. If you're the first person in the operating room and have no one to help you put on your sterile gloves, keeping your fingers inside the sleeve of your gown, use them to open the underglove packet. These puncture indicator undergloves should be half a size bigger than your normal glove size. Pick up the right glove through your gown, flipping it over so the fingers face towards you. With your left hand also inside the gown, grasp the folded cuff of the right glove and pull it over your hand. Tug on the sleeve to reveal your fingers inside the glove, making sure not to pull the cuff of the gown up farther than your knuckles.